This is Jodie, accompanied by her parents. We are following her as she starts her scoliosis surgery journey from her first outpatient appointment and the tests she needed before surgery through to her operation and eventually going home. Clinics are held in children's outpatients with the spine surgeon and specialist nurse. If surgery is needed, the surgeon will look at your back and your X-ray images to decide how much of the spine needs to be fused during surgery. We need to do lots of tests and investigations to make sure you are fit and well, and to give the surgeons all the information they need before your operation. These will include a series of X-rays of your back and side, and also bending and traction views to check how flexible the spine is. A lung function test, which involves breathing long and hard into a tube to see how well your lungs work. An MRI scan, which gives detailed images of the spine and spinal cord. During this scan, you will be lying down and it can get noisy, although music can be played and you can talk to someone if needed. Clinical photographs, which are taken before and after surgery to see how your body shape has improved. Swabs to check for infection, and 2 lots of blood tests to check how fit and healthy you are. Before you come in for your operation, your height and weight will be recorded and a urine sample will be checked for any signs of infection. There's also an opportunity to look around the ward and intensive care unit with your family and the specialist nurse. Coming into hospital, you will be admitted onto Ward 22, which is the Children's Surgical Ward at the James Cook University Hospital. It's here where you'll meet the specialist nurse on the morning of surgery, usually around 7:30, and your blood pressure, temperature and pulse will be checked. Some cream will also be put on the back of both hands to numb the skin, so it won't hurt when the anaesthetist has to use a needle to put the small tube in your hand. If, however, you have a needle phobia, you can request a gas induction using a face mask. Paperwork will also need to be filled in, and you or your family will be asked a series of questions such as when you last had something to eat and whether you are allergic to anything. One of the surgeons may come to the ward to check there are no problems prior to surgery and to answer any questions that you may have. When it is nearly time for the operation, you'll be asked to go down to the Paediatric Surgical Day Unit, a holding area for young patients, with the specialist nurse. You'll then be asked the same questions you were asked on the ward before going into the anaesthetic room, where a doctor will explain what is going to happen and give you an anaesthetic which goes through a small plastic tube into the hand. This tube stays in place during and after surgery. And when you are asleep, the specialist nurse will take your parents back to the ward. There's a lot going on in theatre that you won't see. For instance, a nurse will put in a urinary catheter so you don't have to worry about going to the toilet until you can move around freely. As the operation can last a full day, parents are advised to go out and come back to the ward around 5 o'clock that evening. When the surgery is over, you'll be taken to the Paediatric Intensive Care Unit, known as PICU, and once you're settled you can see your family. This will be your home for the first few days after surgery, and you'll receive one-to-one care in a friendly environment. You may feel tired and sleep a lot, and to keep you comfortable, a button is available to press for more pain relief. You'll be visited by a physiotherapist in intensive care to practice breathing exercises and other exercises to get you moving around as soon as possible. Over the next few days, tubes will be removed, your wound will be checked and the dressings changed if needed. There are usually no stitches or staples to take out. By day 3, you should be back on the ward to begin your rehabilitation and recovery. Before going home, the physiotherapists will ensure that you are able to walk around independently, and they will also need to make sure you can safely go up and down stairs. Your height will be measured as most patients grow after surgery, and another X-ray will be taken to check your metalwork is okay. You should be able to go home within a week once everyone involved in your care is satisfied you are able to manage at home.